Section 2 of the Ultimate Facialist. So we are going to have a little look over health and safety. Section 2, health and safety. Contraindications. Let's just quickly go over what else we're going to check, and contraactions. So a contraindication is a condition that serves as a reason not to take a certain medical treatment due to the harm that it would cause the client. So as an example, let's say you are about to do a facial and a client has, let's keep it really simple, conjunctivitis. Conjunctivitis is highly contagious. If they have something contagious, they are not able to have that treatment. That means we would contraindicate them and they wouldn't be able to have the treatment at that time. And what you would do in that instance is just recommend that they pop to the chemist, so the chemist can give them some medication, some antihistamines, whatever it is that they may require to help get rid of that conjunctivitis in this instance, and then they would be able to come back. Clients that have sensitive skin could be contraindicated to certain treatments. If clients have sensitive skin, I would personally be patch testing everyone. Now, you don't need to patch test in facials. However, if someone does have sensitive skin, maybe someone is pregnant, someone wants a facial before a big event, then I would absolutely patch test the products I'm using just to eliminate any risk. Let's just have a quick look here and see if there's never performed a treatment if there are clients with known allergies. They're in poor health because they'll have impaired healing. Any recent laser treatment, you want to give it a couple of weeks. Botox or fillers, 2 weeks. If they are using prescribed for Accutane or medical grade acne treatments, then you would wait until they've stopped taking those. Recent permanent makeup, wait 6 weeks after second procedure. Clients who have scar tissue, I mean, we'll use our common sense in these situations. Some clients will be absolutely fine that have scars, but if they're recent scars, you want to make sure they are healed before you are putting too much product or, devices, ice globes. What else do we use? High frequency on their face. Blood thinning medication. Generally, if you're just kind of massaging and it's a light facial, you're going to be fine, but you wouldn't want to be doing any invasive facials if clients are on blood thinners. Haemophiliacs or other blood disorders, recent facial surgery, a history of anaphylaxis. So anaphylaxis is an extreme allergic reaction. Clients that have had anaphylaxis before will generally carry an EpiPen and will be aware that they have certain allergies. So it's just important to check the product ingredients if you are offering a facial if a client has certain allergies. There's a list here of contraindications. I mean, I'm not going to read through all of it with you, but I did want to just break down the manual for you a little bit. However, you've always got this manual to refer to, and you'll have the support from us if you do need any questions in terms of contraindications, but have a little look at your manual. There are some images here of contraindications. It mentions on the top one here, infections, cold sores, eye infection, colds, styes. There is, what's the facial one called? Impetigo. Anything like that is an absolute no. Swelling, scar tissue, bruising, undiagnosed lumps and bumps, moles, loss of sensation. These aren't necessarily contraindications where they cannot have the treatment, but it's definitely something that needs to be looked into. Let's say, for example, a client's got a couple of moles on their face. Absolutely fine, but you'd want to be careful if you're using a device like a high frequency machine or the scraper for extraction. You just want to avoid that. Allergies to products, eczema, varicose veins, heat rash, sunburn. I mean, if a client's sunburnt, their skin is definitely going to be slightly tender. Skin thinning products, when the skin becomes thin due to the use of retinol A. So retinol products, vitamin A, speed up the cellular renewal process. Fungal ringworm, I mean, if they're showing signs of any sort of fungal infection, then you are going to recommend that they pop to the chemist. And then a contra-action. So a contra-action is something that happens either during or after the treatment. So let's say, for example, you're doing the facial and you've used a toner that has rosehip in it. I mean, I am slightly sensitive to rosehip. So if I'm having those products on my face, I start to go a little bit red. So that could be an example of a contra-action. Or another example could be, an extreme reaction. Actually, it doesn't even have to be extreme, but an allergic reaction after the treatment. So we just read a little bit of this out. Contra-actions are reactions of the client which is caused during or after the treatment has taken place. It's imperative you explain to your client what, if any, reactions to expect during or after the treatment. I mean, you'll always go over contraindications, contra-actions, risks, what can happen within your consultation, so you are covered. Expected normal reactions could be a bit of puffy skin, erythema, which is redness, blood spotting. You could have that if you have taken off a hair or you've done a bit of extraction. Unexpected abnormal reactions would be an allergic reaction. So redness, irritation, burning, severe swelling is another abnormal reaction, soreness, histamine reaction, so itching, swelling, or reddening of the skin. Any of this, you would probably want your client to pop back in so you can have a look, and then you would recommend that they pop to the chemist or the GP if it's not something that you are able to give advice on. Let's move on to the next section.